I was asked by Mayor Spinell to speak this evening regarding what's been going on at Glen Cove Hospital over the last few months and where we're going into the future. And I'm going to divide my talk and share my time with Dr. Dunn. Just going to give a little background information about Glen Cove Hospital. As was mentioned earlier, it was started way back in 1921. Decades before North Shore Manhasset and Long Island Jewish came into existence. It was founded by one of the people founding it was a son-in-law of Teddy Roosevelt, who was a prominent local physician by the name of Dr. Richard Derby, who became the first chief of surgery. It was initially called North Country Community Hospital. It's changed its name several times over the years. But over the next 70 years, the hospital grew in stature and in size. And then approximately in 1990, which is when I came to the Glen Cove area, it was a time of hospital consolidation. And Glen Cove Hospital went into a formal merger with North Shore Manhasset. And that was actually the beginnings of the North Shore Health System. Since then, North Shore has been joined with Long Island Jewish. It's now the North Shore Long Island Jewish Health System. It now comprises approximately 15 hospitals, and it extends well off Long Island, into Staten Island, into Manhattan. Over the 20-plus years that Glen Cove Hospital has been associated with North Shore, the hospital has prospered. It developed a renowned physical medicine rehabilitation unit, which is really the envy of the tri-state area. It developed nationally and even world-renowned orthopedic program, performing more total joint replacements than any other hospital on Long Island. Visiting surgeons from Europe and Asia not infrequently came to the hospital to see how we were able to perform such complicated orthopedic surgical procedures with such great precision and with an extremely low complication rate. But all through this time, Glen Cove remained true to itself. It remained a community hospital that could be counted on by the local residents. Dr. Dunn was telling me earlier that when the hospital first was founded in 1921, it occurred after 3 pivotal events. There was a polio outbreak, there was an influenza outbreak, and there was a terrible snowstorm. Well, we don't have much polio anymore, but we still have the flu and we still have snowstorms. So I think most of us would agree we'd like to continue having a community hospital here. But in recent years, Glen Cove maintained tremendously high quality. Certain healthcare parameters are determined within the system, determined by Medicare. There was tremendous patient satisfaction as well as employee satisfaction in Glen Cove Hospital. And just a few months ago, a renowned international publication, U.S. News and World Reports, rated Glen Cove Hospital in the top 15% of all hospitals throughout New York State. And New York State has some of the finest hospitals in the world. So it came as a bit of a surprise 6 months ago when the health system came to a determination that it sought to eliminate inpatient services at Glen Cove. A meeting followed with then Mayor Swazi, representatives from Congressman Israel, several members of the North Shore Health System, and some local physicians. And shortly thereafter, there was an agreement to maintain a certain number of short-stay beds. It was thought that there might be 18 to 20 beds with very limited ability to remain hospitalized. Many local residents and local physicians were not happy with this option for a community hospital, and the community organized. There were multiple rallies at the hospital, at the library up in Bayville, an advocacy group formed in Bayville, spearheaded by former Mayor Vicki Siegel, and local politicians became more involved and responded, and Assemblyman Levine introduced legislation in Albany to call for public hearings prior to any changes to the hospital by the health system. That was co-sponsored by Assemblyman Montesano. A similar bill was introduced by Senator Marcelino, and subsequently Mayor Spinell engaged in talks with representatives from the health system. But unfortunately, as is the case in Washington as well, sometimes the political process doesn't move as quickly as some would like. Subsequently, Dr. Holm Anderson, an esteemed colleague who's been providing medical care to the community for more than 40 years as the head of gastroenterology, he sought and retained legal counsel. He introduced, an attempt was made to obtain an injunction in Nassau Supreme Court. Although the temporary restraining order was denied by Judge Driscoll, a follow-up hearing was scheduled. But during this recent process, some meetings have been held with representatives of the health system, including Dr. Battinelli, myself, Dr. Dunn, Dr. Holm Anderson, and numerous other local physicians. A proposal was put forward that would call for keeping Glen Cove as a full-service hospital going forward. There certainly will need to be some further meetings and some future negotiations to try and work out all the details, but there's certainly some promise in recent days. And now I'm going to ask Dr. Dunn to continue on.
I'm here primarily